from the organizers' behalf, I wish to say that this webinar is just a beginning, and we are going to get opportunities to have interaction guidance from experts like Sanjeev Rastogiji and many others who are present here. Friends, in this WhatsApp era, we think that posting WhatsApp and forwards is all done, but is it so? How do we use media and publish? Our colleague, Professor Kishore Patwardhan from Banaras Hindu University is going to talk about this positioning case report. So over to you, Professor Kishore.
So yeah, thank you for giving me this opportunity to speak before this gathering. Well, as Girishji rightly mentioned, even Dr. Ram Manohar ji earlier mentioned that we are treating thousands of patients of COVID in the era of this pandemic. And what we are doing is many of us are just taking the screenshots of those or photographs of those reports where the patient turned RT-PCR negative, or maybe the D-dimer was brought down or something like that. We take those photographs and then we post on our social media profile, or we just post them on WhatsApp groups. And we think that yes, we are now convincing all others that yes, Ayurveda is working. But it is not sufficient. It is not sufficient to write on social media platforms or WhatsApp messages to say that Ayurveda really works. And this is a golden opportunity that we have to show to the world that yes, Ayurveda physicians have contributed a lot in the controlling the pandemic in India. This will be a historical contribution. But in this case, we need to tread very, very carefully, because all claims unsubstantiated by evidence are going to harm our reputation. So with this, I would like to begin my presentation. So how to position? So social media, when you post something on social media, there are several ethical issues that come up. For example, the patient's name might be visible on the photograph, or the address might be visible, phone number might be visible. This is ethically wrong, right? There may be conflict of interest because you might have used your own medicine that your pharmacy has manufactured. There is likely to be a conflict of interest. Hence, these and you want to propagate that you are treating COVID cases. That would again add some bias component to your reporting. So social media, writing in social media has got lot of problems of its own. It is a double-edged sword. We need to use social media very carefully. Then there are two more options. So how to go about this? If we have really done something good, if we have some maybe 10 cases, then we should go for a case series. If one case, then we have to go for a case report, and carefully we should document the cases as per the guidelines that are available. So CARE guideline is the one that is applicable for case reporting. And after writing the report using all the guidelines that are available, we may consider submitting it to preprint server. And after that, we can consider submitting it to scholarly journal, because once you submit something to preprint server and once it gets published, you can always claim that yes, you were the one who published that report first, right? So this is the use of preprint servers. So preprint servers are not journals, but there are some filters that are applied before publishing your paper in preprint server, but it is mostly easy. It has to adhere to certain standards. So first you can publish with preprint servers, and then carefully you can submit it to scholarly journals, because scholarly journals, when you submit, they are going to take a lot of time, because the peer review is a long time taking procedure. Most of the times, especially during pandemic, the peer review happens to be one of the most badly hit sector in science, and that is why science publishing is facing a lot of criticism these days, because of the delays that occur with the delayed peer review process. So now, types of reporting and strength of evidence, as Rastogiji has already informed. The case reports actually, they stand at the bottom. So their value in the evidence pyramid is low, but they have got their own unique value, because case reports can generate hypotheses. They can be they can add some very important value to the existing literature. And then comes case series, and then case control studies, then observational studies, clinical trials, systematic reviews, meta-analysis. So these are the high up in the evidence pyramid. But what you can do as a cases on a daily basis, what you can do is you can either do a case report, or you can do case series, which is very, very easy given the setup in which you are working. So when you should consider writing a case report? So if you are simply have treated a case which would have otherwise also cured without your intervention, this is one of the important aspects where we need to be careful, because around 90 to 95% of the cases of COVID, they will revert back to normal, right? They will be cured by themselves, because viral diseases, all viral diseases are self-limiting in nature, right? So more than 90 to 95% of the cases are going to revert back to normalcy, even in the absence of any intervention. Not only Ayurveda, not even allopathy, nothing is required in most of the cases, right? Hence, when we claim that yes, my treatment has shown this effect in a particular case, then we should be able to sufficiently have credible evidence to show that yes, this is something that is because of my treatment. Because we don't know what would have happened if our treatment was not given. We don't know what would have happened if no treatment was given. See, that is why placebo controlled, comparable or controlled trials are done. So when writing a case report, please ensure that you are reporting some unusual observations, rare observations, because this is a new disease. Each and every case will have some unique presentation, right? Unusual observations are very common these days, right? Unusuality has become usual, and this is the opportunity when we should be writing more and more case reports. So adverse response to the therapies, if you have observed some adverse response, then also it is our duty to report. Unusual combination of conditions leading to confusion, this could be another instance when you would be writing a case report. Illustration of a new theory, you can go with the new theory to write a case report, right, to substantiate your theory. Question regarding a current theory, right? All this can happen with a simple case report, right? And then personal impact, like as Dr. Rastogiji rightly pointed out, he wrote a case report of his own. So that is indicating the personal impact. So this is the first case of COVID infection in India. Rastogiji has already shown this. It was published in Indian Journal of Medical Research. Then JIM, Ayurvedic treatment of COVID case report. This was the first case report that was of a case which was exclusively treated with the Ayurvedic intervention, right? Then the use of integrative therapy based on yoga and Ayurveda in the treatment of high risk case of COVID with multiple Journal of Medical case reports, right? So what I'm trying to say is, there is no dearth of journals. There are so many journals nowadays which are willing to publish case reports, right? Only thing is that we need to be open minded and have an open eye, so that we should look for the appropriate place to publish. So appropriate positioning is very, very important. So care guidelines are the guidelines which will guide you to write the case report. They have got a checklist, and as per the checklist you can write. So this is Ayur Case Archive being hosted by Amrita School of Ayurveda. A wonderful initiative, a timely initiative, where one can submit as many as case reports as possible before publishing or submitting it to any journal, right? So this is a wonderful initiative, and we should make use of this initiative. There are only few COVID related cases that have been published on Ayur Case Archive. I went through that. So it is, see, this is one of the very good opportunities that we have, and we should be utilizing it. Of course, I'm not a practitioner, so what is my qualification to talk about these things? I'm working as a reviewer, I'm working as an editor, and I'm a known critic of the systems, medical systems and medical education. So that makes me what I'm speaking today, right? Then Journal of Ayurveda Case Reports, which is being published by AYA, a wonderful platform. They are doing wonderful peer review, and we must make use of such journals which are exclusively meant for Ayurveda, right? If you search for case reports and Ayurveda on PubMed, you get 253 results, 253 results, and more than 50 journals you get. So more than 50 journals have published Ayurveda related case reports. So there is no dearth of journal. This is a one very common myth that is prevalent among Ayurvedic researchers. Where to publish? Only 1 or 2 journals are there. Only JIM, IU and ASL, only 3 journals are there. So these are the, I mean, very often given excuses, but you should open up yourselves and see what is happening outside. So care has to be taken while writing a case report that, yes, journal specific approach has to be adopted. In a mainstream journal, if you are trying to include how the pathophysiology of COVID is understood in terms of Ayurveda, and if you start including so many technical Ayurvedic terms or Sanskrit terms, it may not be feasible for them to publish. So for them, you should write it as COVID. But if it is an Ayurvedic term in journal, you include what is your diagnosis as per Ayurveda, what Ayurvedic principles you followed. Even if it is a mainstream journal, you can add 1 or 2 lines of Ayurvedic understanding as a separate paragraph. But more than that, they may not allow. So this needs to be done very, very carefully. This is where we need some maybe help from experts, right? So this is the area where we need to tread very carefully. Then ethical aspects, maybe salam is like slicing, for example, the same case report, right? The respiratory symptoms submitted to a respiratory disease journal, fever and other cases, other aspects submitted to a medicine journal. So this becomes ethical violation, right? All documents, investigation reports and other things must be available with you. And again, patient's consent must be there. Whenever you treat a good patient successfully, please take a patient consent in writing so that whenever you find time, you can publish the case report. Right to write. Who owns the case report? You should read this paper carefully. I strongly recommend, because many of the times, as Rastogiji rightly said, many of the times what happens is somebody has already treated a case and then he comes to you, and then you may contact the earlier physician, and then maybe you can jointly treat the patient, or maybe there is some more inputs required from some other physicians, maybe a team is involved. Then who should be writing the case report, right? Should an intern who is looking after the case, should he be allowed to write a case report, or should the actual physician who is looking after the case, should he be writing the case report? See, there are several such ethical issues, and I think this is a paper which will give you a right idea about who owns the case report. Yes, with this, I thank the organizers for giving me this opportunity. We are already running short of time. I conclude my talk with this. Thank you. Thank you, one and all.
Thank you, Kishorji, for this talk. And I am sure the participants will get an idea where to publish our case reports, including journals and the online platforms like Ayur Case Archive. We have also shared the link of Ayur Case Archive in chat box. Please go through the link and you can publish your cases in Ayur Case Archive. And then at the same time, after publishing on such preprint servers, you can again submit to journals. It is possible, and many journals accept accordingly. We now request, thank you, Kishorji, once again. We now request Dr. Unni Krishnanji from United Nations University. And Dr. Unni is editor of Journal of Ayurveda and Integrative Medicine, and as an editor and reviewer, how he looks at case reports and how we should maintain the quality and the standard of the case reports. Over to you, Dr. Unni. Thank you.
Thank you, Dr. Girish and Dr. Ramanohar, for inviting me. Am I audible?
Yes, you are. Slides are busy.
Thank you.
Yes, please make
thank
it
you.
full screen. Yeah.
Okay. Yeah. So I'll be brief. Some of the points have already been covered. But I'm doing this based on my experience in the recent past. I've been reviewing some case reports and case series, and in general, many Ayurveda and Ayush-based research studies. So some insights that I want to share today are purely from that, and these are very simple, and I understand that many students are attending this program, and I hope this will be useful. So, okay. So when we, I would like to define these points as some of the quality aspects which are related to our perspectives and looking at the new condition like COVID-19. Some of them about logistics, some of them about the manuscript itself, and finally about some of the ethical issues. So if you look at from the first point, perspective related, I think we've been into the pandemic for last 15 months or 16 months now. But in terms of the Ayurvedic understanding of the profiling of the condition, I think in the first wave, many of us started working on it, and there has not been a consensus on how do we profile disease according to Ayurveda. And but we do have some understanding. In the second wave, again, the symptom patterns have changed, and we are seeing a completely different presentation now. So I think it's important when we develop these case reports, we need to have a good understanding of this profiling, and that's very important. The second point is about we have been having criticism on some of the case reports that were already published in the early days because of a lack of good understanding of the profile. We had published some mild moderate cases which anyway could have been healed without any intervention. So I think we have to be mindful of these criticisms, and we should plan for, we just need to think through what is the unique aspect that we will be contributing to the field of Ayurveda and science, just to avoid such criticisms. Then, as mentioned by some of the speakers before, I think in terms of the approach, we need to clearly define whether it is a standalone approach, add-on approach, or a pre-planned integrative approach. And I think this is very significant. In many case reports that we review now, these are not explicitly mentioned. And as Dr. Rastogi already mentioned, I think our approach is very personalized and systemic. And that's slightly different from the case reporting from the modern medicine understanding. So I think describing the specific personal and systemic characteristics and their analysis, how do we differentiate in terms of the understanding of the Roga and Rogi? This also becomes very significant. Then, of course, the logistics related. Now, many of us do online consultations, telephonic consultations. So it may be very difficult in emergency situations to get detailed understanding. In institutional settings like All India Institute of Ayurveda, it may not be a problem. But I think we need to try to get maximum documentation. Now, the second dimension is the manuscript-related points that I would like to say. We are not reporting any Ayush theory, but reporting clinical observations about a particular case. So we have to be very specific. The management may be very long. 2 weeks, 3 weeks, if we are taking care of a patient, I think we may be giving around 10 to 12 medicines at different times, etc. But so it is important to give a summary of main management approaches, not the intake of medicines on a day-to-day basis, and say which are the important medicines, therapies, or procedures used. And in some of the case reports that we see that the management itself runs into 4 to 5 pages. So that's not a very good situation. Now, multiple methods, this has already been mentioned. We use Ayush Kada, the Guduchi's Kanavati, or Ayush 64. Multiple things are being practiced by the patients and practitioners. I think there needs to be clear logic and precise description of at what stage what medicine was given, and the chronology of this management approach is quite critical. Then something about the technical term correlation. I think we very often fault at this. either conceptually or technical correlations. For instance, Deepana, here in one paper, it was correlated to improves digestive metabolism. I mean, it doesn't really say much. So I think there should be, but we are caught in a situation where we should we are asked whether we need to correlate in a general as a generic term or in specifics. So I think it should be a balance of the generic and specific features. So we need to be mindful of these correlations, both conceptual and technical. Then we need to gather maximum material, but screen most relevant and summarize only main content in the discussion section. And I think many often Ayurvedic physicians or Ayush physicians find it very difficult to, because in a case report, only in the discussion section, you can really talk about the literature and the related material. So I think summarizing that in a good way is very much essential. And on the right side, avoid sweeping conclusions. See, this is a conclusion in a case report that I recently reviewed. It further reinforces findings of earlier studies that undermine the myth that the systemic diagnostic scheme of Ayurveda is incapable of dealing with complex infections. This is not an outcome of case report. Or the second one is this validates the homeopathic concept of genus epidemics, which depend on the expression of disease rather than causative factor. So here we are not trying to prove a theory, but as Dr. Kishore mentioned, it's a hypothesis or a clinical experience that we are reporting. Now, in terms of the manuscript structure, Dr. Supriya will be speaking about it, but I would suggest that the title abstract keywords should be really sharp, precise. See, one of the things that I recently reviewed, potential of Ayurveda-based standalone management of pulmonary infection. This is a too broad a title. I think we need to think how in 10 words, I mean, sorry, it's not 10 lines, but in 10 words, we can precisely explain what we have in mind in the title. Then in the introduction, what is known, what is unknown, why the case report is very important. I think that should have a good quality and the chronology of events, including the lab tests, CT X-ray images, whichever, and if it is available before and after. And as Dr. Kishore mentioned, no overinterpretation of results or claims. Future study possibility could be given in a case study. And it is very difficult in a case report to make any conclusive discussion or conclusive evidence about efficacy of a particular treatment. That's why it is in the lowest level of the ladder of, the hierarchy of evidence. So I think we need to create an open-ended conclusion, not a very conclusive discussion. Of course, adverse events should be reported. We don't need to be defensive about any adverse events. Some tend to be quite defensive, that's not required. Then style related, follow the exact journal style and reporting structure. Word count is very important for case reporting. And 1 or 2 figures, some journals allow. The formatting should be journal specific. And if submitting for foreign journals, I think as Dr. Kishore mentioned, be very precise about the medicines and technical terms. Many of the Ayurvedic terms may not be understood. Diacritical marks are not available for Ayurvedic terms. So look at most suitable possible transliterations. Botanical names and chemical names are really essential, but for big formulations like Maharasnadikotha or something, we cannot give the botanical name. So just end with the names. Adding a figure to abstract and summarize would be a good quality reporting. References 5 to 7 maximum. Then like abbreviations, I think most people tend to write COVID first line treatment centers as CFTC. So I think it's not good to leave abbreviations. Avoid superlatives like very good, extremely clear, excellent, improvement, and so on. And it is better to do an internal review before submission. That really helps. And responding to review comments in a precise manner will also really help in sharpening the quality. Then finally, about the legitimacy and ethical aspects. If you're using the national protocol guidelines, etc., state guidelines, mention that in the case report. If there is any deviation, as Kotejaji already mentioned, there is therapeutic privilege for a physician, and he clearly asserted that. But if there is a deviation, I think that should be mentioned specifically. Make reference to Ayurvedic Pharmacopoeia of India, especially if you're submitting to foreign journals, API or Ayurvedic Formulary Essential Drug List. EDL is available for many states, so that could be reported. Then, of course, de-identifying persons, this was already mentioned. Respecting patient autonomy. Even don't even refer to a patient as a diabetic came to my clinic or an epileptic came to my clinic. So these are all questions of autonomy and integrity, identity of a patient. So an informed consent already been discussed. And not writing against anybody, a professional practitioner or an institution is a good way. Authorship, there are these international committee medical journal editors, recommendations are available. And many people ask, so how should be the authorship defined? So it is based on the quantity and quality. You look at the recommendations, you have more information. And mention if there is a quality of interest. Finally, I think plagiarism check is very important. So thank you.
Thank you, Unniji, for sharing those do's and don'ts and the details. I'm sure you will be interacting with participants in forthcoming workshops. Thank you very much. I now request Dr. Supriya ji. Dr. Supriya Bhalerao is a scientist from Interactive Research Schools of Health Affairs from Bharati Vidyapeeth Deemed University to share the reporting standards for structuring our case reports. Over to you, Supriya.
Okay, good evening, everybody. And by now, you all are acquainted with what we are actually discussing, and some of the aspects like how to write case reports also have come in the previous presentations. So I will directly take you to the care statement and how to write the case report in using that care statement. Basically, what is care? It is a guideline for drafting case reports with an objective. These guidelines are framed with an objective to ensure accuracy, transparency, and usefulness of case reports. And these guidelines are endorsed by multiple medical journals, including all the journals which are participating today in this webinar. And these guidelines are available at carestatement.org. If you just Google care statement, you will find these guidelines. And there are some online teaching modules also available, which you can avail after these sessions also. So what exactly the case statement is, it starts with all the components of case report and how to write it. So first part is title, and it is clearly stated that diagnosis or intervention of primary focus should be there in the title. And every time when we are publishing a case report, there has to be a suffix case report. So you must have seen in Dr. Rastogi's presentation, even in Dr. Kishore's presentation, whichever case reports were displayed, every time there was a suffix case report. Keywords, there have to be keywords 2 to 5 in number, which will identify diagnosis or interventions in the case report. And I would suggest you that they have said that the keyword should include case report, but other terms like whatever there in the title you should avoid, because when anybody will search with these keywords also, your paper should be or your case report should be displayed on the Google. So use some keywords, use the words which are different than your title, so your case report will get highlighted. Then in case of abstract, which is a point number three in care statement, it has to be written without any references, and it is a short version of the whole case report. Actually, it has to be written once the paper is complete, and whatever gist you want to present, it should come in the abstract. It is like the same thing which is trailer to a movie. So we should make a gist and a crisp presentation of the whole case report in the abstract. And the end of the abstract should be with a takeaway lesson, which is a main takeaway lesson from the case. Then the actual paper, when it starts, case report starts, the first part is introduction, and there has to be 1 or 2 paragraphs summarizing why this case is unique. Now, I was just thinking, like when multiple case reports will start coming up, we cannot have even in a title that Ayurvedic treatment for COVID or a case report, because then there will be multiple cases after these kind of webinars and workshops. So we really have to have something different modality, like how we should frame our titles. Same way in the introduction, we should not start with that coronavirus has come from China in 2019, and then when WHO announced it as an emergency, these all kind of information, or as Dr. Unni was referring, we don't have to talk about Ayurveda. It is an age-old science and how it helps in multiple diseases. This all information is known to everyone. We should directly come to the case and what we want to write about the case in that introduction part. Then comes the part of patient information, and as it has been told by Dr. Unni, that is an ethical aspect also, that we should de-identify patient-specific information. We can simply write a male patient of 63 years old or something like that, but we should not mention the names or initial of the patient. Primary concerns and symptoms of the patient should be highlighted here. Medical, family, psychosocial history, including relevant genetic information. Now, this everything is not related or relevant in COVID case reporting, but this is what care statement talks about. And whenever we are discussing patient information or diagnostic aspects, we are welcome to put, or we should mention the Ayurvedic part of it also. Suppose you want to write that the patient was of Pitta Prakriti, Kapha Prakriti, you are welcome to write in the patient information segment. Then the relevant past interventions with outcomes. Again, this may not be very relevant with COVID-19, but yes, you can mention the comorbidities the patient is having, and this all should describe, this whole section should describe what is the patient's state as of now when the patient came to you and what were the past history of the patient. Then clinical findings. In clinical findings, significant physical examination and important clinical findings. Whatever pulse, vitals, oxygen level, whatever you want to find, mention as clinical findings should come in this part of case report. Then there should be a timeline which will describe about the historical and current information from this episode of care organized as a timeline, like when the patient first developed the symptoms. And I'm going to show you with some example if time permits. So when the first symptoms were developed, or when the patient approached to a clinic, and when he was diagnosed, and what medicines he took in the beginning, and then how the case proceeded. So everything in a timeline manner should come at the point number 7 of the care guideline. Then there is a diagnostic assessment which includes physical examination, laboratory testing, imaging, and as we all know that in COVID, all these things are extremely important. So whatever tests you have done, or the imaging like HRCT, Dr. Rastogi has shown a case of HRCT. So whatever you have done, all the diagnostics testing, and even the Ayurvedic part of testing, if you have taken Nidra, Agni, Koshta, all these details should come in this part. Diagnostic challenges such as access to testing. For example, since RT-PCR was not available, the patient was diagnosed on the basis of rapid antigen test. So these kind of things should come here. Diagnosis and other diagnosis, differential diagnosis, if you have considered any, so that should also come here, and the prognosis. And as Dr. Unni was mentioning, if you are mentioning like mild, moderate or severity of the COVID cases, then you should use a proper categorization which is there. You should not have your own judgment about this kind of categorization. So you should use the guidelines which are available for grading the patient. Then about the therapeutic intervention, you have to mention about the types of therapeutic intervention which was used in the patient, such as pharmacological. That means all the treatments. It can be kadha, it can be gutti vatti, it can be nasya, it can be any sort of treatment which you have given to the patient, and the non-pharmacological treatments also. For example, if you have asked the patient to do some anulom vilom kind of pranayam or anything which is in a non-pharmacological domain should also come in this part. And self-care, like whatever general precautions were given to the patients, have hot water or anything which you have prescribed to the patient as a part of intervention should come here. Of course, diet should also come here if you have advised any specific diet. Then administration of therapeutic intervention, in the sense all the details of the medicines such as dosage, strength, duration, for how long, and if you change the medicine during the course of treatment, that everything should come as a timeline. And changes, as I said, changes in therapeutic intervention with rationale. Why you added something to the treatment, or why you removed something from the treatment which was initially planned, that everything should come under this part of the care statement. Then the important part of any case report is follow-up and outcomes. So how you documented the outcomes of the treatment, and After me, Dr. Asmita Vele is going to speak on this particular aspect, like how we should document the outcomes. But generally, clinical and patient assessed outcomes, if they are available, then they should be given first priority, because overall assessment or anything which is more important for patient, that patient's breathlessness was decreased, or when patient started feeling good, the fatigue has gone, or something which patient feels very important rather than the investigation, that should also come in the outcomes. Important follow-up diagnostic and other test results. Suppose you have done D-dimer in the beginning and you have repeated D-dimer test at the end of the treatment. Ideally, you should repeat to have a complete idea that how your treatment behaved or how your treatment worked on these important criteria or important indicators of COVID-19. So that information can also be included in this part. Intervention, adherence, and tolerability. Whatever interventions you have given, you might have told the patient to do pranayam. You might have told the patient to have simple application of Govt, for example, in nostrils. But whether patient has done this or not, and whatever treatment you have offered to the patient, whether all the treatments were tolerable to the patient, all these things should come under the heading follow-up and outcomes. And most importantly, which generally we miss, that is adverse and unanticipated events. Suppose something has gone wrong after taking your medicines or any specific symptom. It may or may not be related to your treatment. You are not confident that whether it was a consequence of your treatment, but something has gone wrong. Patient has vomited once. Let us say, for example, patient started loose motions, which may not be really related to your treatment, but this has to be recorded as adverse and unanticipated event in the main report, which you will be publishing or submitting to the journal. Then comes the important part, which is discussion. And in that section, in this section, we have to discuss all the aspects which are dealt so far. A scientific discussion on the strains and limitations associated with this case report. That though you have mentioned about so and so things couldn't be documented in the patient, or patient felt better on these parameters, but patient could not get any success or any relief or any successful outcome on certain parameters, that has also to be specified. Discussion should also include the relevant medical literature with references. That means if there are any such cases, or if you are using some particular drug, then whether this drug was used in some similar cases or influenza-like illnesses. Suppose somebody is writing on AYUSH 64 use, then there is a published paper on influenza-like illnesses. There are many papers now published on AYUSH 64. So you can refer, if you are using any of those ingredients, also in your treatment, you can mention of the published papers on AYUSH 64. The scientific rationale for any conclusions. So Dr. Kuni has nicely mentioned that our conclusion should not be like look like tall claims, or we should restrict ourselves to whatever is the real outcome of the case, and we should not make big statements or big conclusions like now this therapy can be used in all cases of COVID-19, because you might have treated only one case. So generalizing the results on the basis of case report or making tall claims should be avoided. The primary takeaway lessons of this case report without references should be included in one paragraph as a conclusion. So this is how the discussion part of the case report has to be framed. And then comes the two important things. They are patient perspective. So generally testimonial kind of thing, whether if your patient has given you any feedback, you can write the same thing in his language in your case report, telling that how patient felt better after taking your treatment. Because many times, and that's why patient-centered outcomes have been given priority in the outcome section also. So whatever is a patient's feedback, his testimonial should be published or should be submitted in his or her own language. And lastly, whether you have taken an informed consent from the patient. If yes, it has to be provided. And it is requested that you should document informed consent. If you have not taken it before treatment, at least before publishing your case, you should take an informed consent of the patient whom you have treated. So this is overall a care statement, and you can use these all points while writing a case report, and the detailed description of all these points is available on the carestatement.org. So you can refer it anytime after this webinar, as I have said in the first slide of my presentation. I will show you these reports because the hyperlink is not working in Zoom. So I will try to show you these papers after my presentation. The next thing which I want to just highlight that sometimes you might have treated 2 or 3 or 4 patients of COVID and similar kind of treatment, and you would like to publish all those cases. So whatever we are discussing is about a single report, but sometimes you might feel to publish a case series where you want to report 4 or 5 or 6 patients whom you have treated. So for that, we do not have any specific or a different guideline. We have to follow the care statement only. But there are certain rules, I mean tips, I would say not rules, but tips which I would like to give you, that if there are less than 5 patients, you can narrate individual patient data. But if you have more than 5 patients, like up to 10 patients, more than 10 patients, we can have, we can present it in some different way. But if you have 5 to 9 patients, then you can publish it or summarize the summary statistics. That means the overall age of the patient was so and so, the mean age, the average age. So you can present as a summary statistics in case of case series. And if you are if you are practicing in an institution and if you have more than 30, 40 or 50 cases, then with institute's ethics committee permission, you can even publish a retrospective observational study also. But as of now, what is important for us is how to write a case report and how to write a case series. So the only difference between case report and case series is you have more number of patients in case series. And this is an example of case series. Let us see how we can see the reports actually. So with this, I would like to stop my presentation here, and I would try to share the papers which I have mentioned in my presentation. So, okay, this is the first kind of case report, and you have seen in earlier presentations also, this is the first kind of case report which is published on COVID-19, and you can see there is a suffix case report. There are keywords as mentioned. Is the paper visible, Dr. Girish?
Yes, it is visible.
Okay, and when we go ahead, there is a case presentation, the patient information, all the headings which we just discussed. So all these headings are presented properly. This is a timeline which I was referring to you, that what happened to patient. The patient presented on 29th of March 2020, which is considered as day 1. And from that day 1, what all happened in the patient, what symptoms occurred, what symptoms got resolved, then whether any test was done and what treatment was given, all this information has been given. And then as I was talking to you, patient's perspective. So here it is actually written in the patient's language that though I was already following social distancing and all, so it is written actually in patient's language. Then there is a discussion and in which the importance of case is discussed and how the treatment given is important, the limitations, the strengths, and there is a conclusion. So this is one case. The another case, I would just like to show only one thing, that is a timeline in a way it is presented. So this is the whole timeline which is presented in a very nice way from 19 June to 12 July 2020, what all things happened in the patient and what kind of treatments were given to the patient. And then and there is a third case which I have specifically selected because there are 2 case reports and I was talking to you about case series. So here there are number of patients are less than 5. So both cases, the narratives of both cases are presented, like case 1 was what, case 2 was what, and then timeline is also presented for both the cases independently. If you can read in the first case what happened and in the second case what happened. So likewise, both the cases are presented here, and this is how you can write the case series. So this is about using care statement for writing case reports. Thank you, Dr. Girish. I think I have covered the points.
Thank you, Supriya ji, for this very elaborate presentation, and you really gave an example how the care statement actually has to be used and which are the case reports. Those are published with this case care statement. Thank you very much, and Supriya ji, your help and guidance will also be required for upcoming workshops, which are going to be organized for interested participants who wish to write case reports on these topics. We have next talk by Dr. Asmita Vele ma'am, and she's going to talk about the templates required, templates which she has compiled for reporting COVID cases outcomes. Over to you.
Thank you, Girish. Good evening, everyone. My job has been made very easy by my previous speakers, especially Supriya. So this will be the quick run through from the format for reporting COVID-19 practice outcomes. So this is the format for reporting COVID-19 practice outcomes. When we say practice outcomes, we are talking about case reports, we are talking about case series, and the points which Dr. Supriya had just now shared with us, and she has shown 3 examples of different case reports. How do we look at the outcomes only? I'm going to concentrate only on that. So here the assumption for this particular session today, the assumption is our starting point is case reports and case series specifically for COVID-19, which is diagnosed as per RT-PCR positive and the CT score from 10 to 100. So this talk is limited to COVID-19 cases and the case reports, which will be based on this particular disease. So there could be 3 types of preventive, there could be many types of preventive modalities. From AYUSH, there could be Kadha, from Arsenicum album, Kushta Kuddus, anything people might have used. Whether they have used it or not, that should be also reported. We need to take cognizance of the previous medications or the preventive measures. If a patient has tested positive for COVID-19, even after taking the preventive measures, then there should be information on signs and symptoms as COVID-19. So the presentation or Rupa will be in the format of the disease which we know today. At each stage and step, there should be supported documents. And with this, we will move towards writing the outcomes. You all are aware that the outcomes will be the supporting documents could be radiological documents and biochemical documents. I need not mention all of them. Probable pointers for these outcomes are the broad category. How is the disease diagnosed as a Vaidya by you? So institutional practices are different than the clinical practices. A Vaidya sitting in his clinic may categorize it differently. So whether the broad category, Janapadodvamsa or Upasargic, that we can definitely write, and we can give its near equivalent meanings as rightly explained by Dr. Unnikrishnan. Then there should be diagnostic outcomes. We are going to see it in detail later. The third type of outcome can be staging of the disease based on the severity as per Ayurvedic terminology and Ayurvedic understanding. And finally, the outcome will be treatment specific. So here I'm showing you a picture where this is a schematic representation of Samprapti of viral disease, for example, COVID-19. And as rightly Tanuja ma'am said in the beginning of this session, that now we are considering it as a Agantuja Vyadhi. So maybe whether it is Bhutabhishanga Jajwara, then it's spread, it enters to, it adheres to Pranava Srotas, Vata is the main dosh which is involved in the beginning, and Rakta is the main dhatu. Then there is staging. It could be mild to moderate. So depending on the Shatkriya Kal concept of Ayurveda, can we think about preventive window, Chay Prakop Prasar from day 1 to day 14? Can we think about Vyakti Bhed and severity or fatality of the disease in the later stages as the disease goes through oxygen dependence or breathlessness, pneumonia, multi-organ failure? So this you can present as the diagnostic outcome depending on the classification. You can see here Vata Kaphaja, is it Dvidoshaja Sannipat, is it Tridoshaja Sannipat, whatever you are understanding sitting in the Ayurvedic clinic, you can mention it, and your symptoms, your samprapti, you can write in detail, or you can add a descriptive, you can add a schematic diagram. Then based again on our understanding, on the Ayurvedic understanding, whether the Rogamarga is Bahya, Abhyantar, Madhyam, whatever you have diagnosed, whatever your thought process, your understanding and study of Ayurveda tells you, you should be able to mention that. How do you see the disease? As in some other places, people have thought it as Taruna Jwara. At some places, they have used the word acute chronic, and we cannot have the equivalent terms, exact translations. Then whatever you have thought, it should be mentioned, because this will allow us, if many people, many case reports are using similar terms, there will be a possibility to generate a hypothesis based on consensus. And the diagnosis of COVID-19, according to Ayurvedic matrix of dosha, dhatu, samprapti, nidan, hetu, everything, it will be the first step. And similarly, we can talk the outcome of disease staging could be based on prognosis also. So how do you see the disease, whether it is sadhya, yapya, asadhya? If you have used continuation of, if you have continued the same treatment throughout, or you have discontinued previous treatment and you have changed the line of treatment, what was the concomitant use of comorbid conditions which are existing in the patient, these will be considered as outcomes for staging of the disease, and we have to write those outcomes. Then there will be treatment outcomes. Now these are quite detailed. Though Supriya has made my job easier, I would like to take you through this, because unless and until the treatment outcomes are very clear in your head, they won't be reflected in the case report. So what are the objectives of this treatment for this particular case or case series you want to intend? Was it prevention when there was no history of known exposure, and you are just advising Ayush Kadha, you are advising Saushamani Vatti as a prevention, and you have seen that case that has not fallen prey in both these waves, that person is taking that kadha religiously in a limited quantity, and that has achieved a very good prevention. That can be also an treatment objective. Then if you have treated the case, whether it is mild, moderate, severe, based on that, your objective will be different. And the last objective of the treatment is post-recovery rehabilitation. So if patients have touched, they have gone into the hospital, they were oxygen dependent, SpO2 was falling up to 70, and the patient is recovered, the patient was taking integrative kind of treatment, we have seen 1 or 2 reports like that, then what was the was this the outcome? Was this the objective of your treatment? That becomes part of the outcome. So apunarbhava chikitsa and prevention of known post-COVID-19 side effects like cardiopathies becomes a treatment outcome in a case report. Next point is choice of drug and therapy. So based on dosha gati, shatkriya kal guideline, have you thought of the drug and the therapy? Like if you have considered that Chayeva Jayat Doshan, there is a known exposure to COVID-19, because people like us who are working in the wards, who are working in the OPDs, they are already exposed. So what treatment was offered to them, what advices they were following, and based on that we can write case reports. Was the treatment common based on this principle of Janapadodvansha, or it was personalized? That becomes a second outcome with the where you will have to talk about the drug selection also, and whether it was completely individualistic approach. I have heard to a few presentations where the patients approached Vaidyas and there was a completely individualistic approach. Even I have treated a few patients with complete individualistic approach, not going ahead with this Janapadodvansha because of the stage of the disease. When they approached me, it was Nija Vyadhi. It never remained the Agantuja one. So that's how you have to think about the choice of drug from the outcome viewpoint. And just like Supriya mentioned, which procedures were advised, whether they were repeated during the entire duration, what happened to, was the patient really willing to do it, and how easy it was to maneuver. That is what is very important, which we should write from the outcome viewpoint. In the individualistic approach, there are certain points which needs to be observed, like the constitution of the person, digestive capacity, physical strength, that is bala, psychological status, and these should be mentioned in again from the viewpoint of outcome. The comprehensive final outcome is very important, particularly in case of COVID-19 case reports. Here we have to see whether the patients have recovered, whether the patients, single patient, or maybe up to 5 or 7 patients in case report and more than 7 in case series, whether they have recovered completely. What are the markers of healthy status that you have looked for? Whether they have resumed their work and life as previous, there is no fatigue at all, whether there is cognition impairment, whether they are still feeling weakness and they feel lost in between. Are there any other episodes? So what have you considered as this is the point, this is the marker where I'm saying that this patient is completely healthy, that we need to decide. If while treating it, let us not assume that we will be able to treat each and every patient where there will be no worsening of the case. There could be Vaidyona Prabhur Ayushaha. There could be patient-related factors. And even if you are doing your best, to the best of your judgment, to the best of your knowledge, the case might worsen. And then you have to report these cases as well. There could be a possibility that in spite of all your efforts, the patient might have succumbed to death. So these type of case reports should also come. If at all Ayurvedic Vaidyas have treated cases in ICUs or treated cases in hospitalized conditions, because nowadays this is a possibility, and many Vaidyas are treating ICU patients and hospitalized patients as well. All this, when we write in using the Ayurvedic knowledge, background and terminologies, the supporting findings which are there, the biochemical test and the radiological test, those report pre and post, before treatment and after treatment, should always be uploaded and shared. You can make a collage of this pre and post test. Legend should be properly put, and you should title it properly, that what exactly you want to show. Some unexpected findings after the treatment, like rash, itching, mood swing, anxiety, whatever it is, there could be anything which should be noted. And very important point, you have seen it, so I will not take time on that, perception of patient towards our treatment. And then in discussion, from this treatment outcomes, we have to mention rationale for the complete treatment and final outcome with reference to Ayurvedic treatment principles. Since we are talking of Ayurveda as one of the major science, which is coming up in a very nice way at the moment, and this is the right opportunity to struck that yes, we have something our Rasaushadhis are working, our Kashaushadhis are working, we have a complete modality, then we should be able to give a proper justification, which you have seen in previous examples shown by Rastogiji as well as Supriya. This is a separate point. That's why I have made it slide treatment outcome number 4. This is for post-recovery rehabilitation. There should be and there must be case reports pouring in for most appeared symptoms today: fatigue, respiratory stress, weight loss, and which is not noticed till date. But as I said, that there are some cognitive lapses people are telling now, or in between everything is fine. After 2 months of the recovery, suddenly one day patient feels so drained out, and that's because at that particular time there is a possibility that the viral load is higher. But this should be tested, and then they should come in. Whether for this post-recovery rehabilitation, the outcome for this particular outcome, if we are using rasayanas, then what rasayanas, why we have selected those particular, for that particular case or cases, that should be written very carefully. Supriya has already talked about care guideline for case reports and clinical case series. This is 2020 amendment, that there is improvement in reporting for clinical case series that has been added. And when you go to the site, from the link provided by Supriya, you can see that. Lastly, we must not forget, this Dr. Kishore also mentioned, that COVID-19 is a self-limiting disease. 85% patients cure on their own. They do not need multivitamin, they do not need cardas, they do not need nothing. Remaining 15%, they might need hospitalization, oxygen. Out of that, 10% will recover maybe with some post-COVID complications. 5% of those 15 might land into severe morbid cases. These 10 plus 5% are more prone to post-COVID complications of heart, kidney, brain, and psyche. Today, rather in April 29, the fatality rate is 1.1. It is still the same. I checked in the morning. It includes, this fatality is also not only due to COVID-19, but it's also due to non-availability of drugs and oxygen. So the field of intervention for Vaidyas is at all these time points, like 15% also, 10% also, 5% also, because now people are approaching us on their own. They are calling, they are visiting, they're asking for dietary guidelines. They're asking for whether guruchi is good, gulvel sattva gheuka ami, that is how they are asking. So this is a time point where we should be proactively guiding, advising, and reporting. So we should make these outcomes very clear, and we should write, but at the same time, we have to avoid tall claims. We should not make tall claims. Dr. Unni also made it clear. Dr. Kishore also made it clear. And one more very important point, which me, Girish, Supriya, Dr. Ram, we all discussed, that while publishing the findings of a case that you treated 8 or 9 months back, we have to take cognizance about the current status, about the recovery parameters and outcomes in our discussion part. What happens is, you have treated the case 8-9 months back or a year back, and then you are writing it today. It goes into peer review, and it takes about 2 months for publication. This has happened to our papers also. This has happened to, many of us who are writing, and we have seen this, that, okay, we wanted to publish this, and now the protocol has changed. So while publishing, we have to consider the current status and then use it, or add or modify the discussion according to the current status, and then write it. We have to be always very, very honest. And that's why I said that if our patient, in spite of our very good efforts, treatments, everything, best skills, and the patient lands in the morbid state, we have to mention it. We should not deter from it. With these words, thank you, Girish, and the whole team for giving me opportunity to talk on this very important aspect, that outcomes. And I have covered, I think, the diagnostic outcomes, staging of the disease outcome, and treatment outcomes. Thank you very much.
Thank you, ma'am, for this very important topic that you really shared, because we should not say that patient became better, but what and how God is in this particular details, and we must share those details. Thank you very much. We invite the next speaker, Dr. Soumit Kumar, who heads ABP Research Foundation, to talk about avenues for reporting case. Over to you, Dr. Soumit.
Good afternoon, everybody. And so today, my topic is about avenues of publishing case reports. And in fact, I'm very thankful to Dr. Ram Manohar and Dr. Tulu ji to invite on behalf of ABP Research Foundation. So in fact, part of my work has already been discussed with Kishore Patwardhan ji, and I would like to just take you through few must before we look out for publishing our case studies. So first thing all our previous speakers have talked about is, has your case some novelty? Is some novel idea coming out of your case, which is unique and thought-provoking and worth publishing? So this is very important thing, which before we think even about writing a case study, and as well as searching the right journals, right place to publish. If you are planning to write a case report, read care guidelines, as my previous scholars and experts have shared. Journals should be both published online and printed version too. Ideally, it can be both. That's the best. So the journal should figure in standard indexing database. It's very important because there are various spurious journals, and you may have a very good case study, but not being published in the right database. So Web of Science, Scopus, PubMed, Medline, they are very important database, very well-known database. And luckily, many of our good Ayurvedic journals are indexed in Scopus, Web of Science, and PubMed. Look for impact factor. That is very important. So if you have a very good, unique case to report, please do look for a good impact factor journal of the area where you are trying to publish. Because see, COVID has thrown a lot of subspecialties in the forefront, because it's not just epidemic, but you have end organ complications. You have renal, cardiovascular, or even neurological. So you may also have to go beyond. If you have a very good case, of course, the Ayurveda specific journals are good, but if you have quality case sheet, case records, please also look for other specialty journals, which I'll show you, which publishes specific case sheet in different specialties. Then one of the best publishing houses, of course, the caveat is I'm not promoting any journal house, but Elsevier, Oxford University Press, Nature, Biomedical Center, then Sage, Springer, Mednaw. These are leading reputed publishing houses. So please look to these nuances, because if you get published in journals published by these houses, you get a better visibility, and also your case sheets are recognized and cited. So it's worth the value you have put in. If the journal charge article fee, yes, this is very important. I'll show you there are many journals who also charge you for kind of, processing your article. So be very clear. Those things are very transparently shared before, and ideally should be payable after the manuscript is accepted. Now, a little why I'm trying to bring this chronology of COVID, because many a time when we try to publish, we are not very sure, as many of our panel expert told out, that what is we are trying to share. Are we trying to share our experiences for self-limiting disease, or a experience in an intensive care, or an outcome which could have been really impacted by an add-on Ayurveda therapy or by Ayurveda? So you have to mention this timeline. So in COVID, we have seen a timeline of treatment, deciding treatment, or even for that matter, if you look at what are the tests to be chosen. So when we are preparing our case sheet, we know that there are specific stages in COVID and there are specific symptomatologies to look after, followed by certain markers, whether it can be biochemical markers, it can be other molecular markers, or even symptomatology. So please see that when we are trying to make these cases, we need to know whether it is infective or pulmonary or hyperinflammatory phases. And based on that, we need to see that we have a correct documentation. Or if we are going into much deeper into how the autoimmune response takes place or interplay of different immunological markers. So see that we properly document it, and so we are ready to really go for a quality journals. Now, I bring to you about this preprint servers. Dr. Ram Manohar has been spearheading a very noble initiative in Ayurveda, but first I'm trying to show you from BMJ. This has been now that before it gets indexed into a reputed journal, you preprint it. It undergoes a scrutiny by not only peers or domain experts, but also by a diverse opinion makers. So what it gives you a chance is to understand the lacunas in your either the work or even some insights which can make your paper much stronger, and you can do right kind of intervention in your paper and can make it better. So it's a very good media to improve the quality of your paper. So I think it's one of the very good initiative from Amrita School under Dr. Ram Manohar's leadership. We have fortunately an Ayurveda specific preprint server. Please, we should utilize this, and especially for case series. It was, I think, a very far-sighted initiative by Government of India, AYUSH, and especially All India Institute of Ayurveda, which already has been publishing this journal of Ayurveda case report since last 3 years. And we have a diverse editorial board and international experts looking at this journal. And so this is one of the avenue. The other very famous journal, of course, Journal of Ayurveda and Integrative Medicine is another avenue specifically for Ayurveda specific knowledge system, because many a times we find out when we are publishing in a journal which is not very domain expert in Ayurveda, we often get sometimes rejected, even though our case may be good, or maybe we are overusing Ayurveda terminologies which is not known to the people reviewing it. So this is a very good journal. Of course, other journal is Ancient Science of Life, which has been there for almost more than 50 years. And this is one other journal you can publish. AYU, of course, this is another journal, reputed journal. And all these journals, what is the best part is they all are PubMed indexed and Scopus indexed, few of them, and they have a good reach and good peer reviewing process. So this is a very important. Now, I was talking to you, but sky is your limit. Like suppose if you feel, yes, you have something very substantial to present. So it's also that you can go to PMJ case reports. There are a lot of, not only this, there are other case report specific journals where you can publish according to different specialties. So if you are looking at end organ damages or specific cases of very unique interest. This is another journal I have just shared with you, which is of course, paid journal. Here you have to pay a fee, of course. So these are also avenues, but the issue is if your quality is good, you can get published anywhere and based on your priorities. So I really thank all the organizers to have given us this opportunity to speak on this topic. Over to you, Girishji.
Thank you, Somit ji, for this presenting various say journals and platforms where the case reports could be presented. Our next speaker is Professor Pawan Kumar Godatwarji, and he's going to talk about scope and limitations of case reports. Over to you, Pawanji.
Thank you, Girishji. My video is not opening. It has opened now. Thanks for collecting this galaxy. And no matter how big a galaxy you have collected, you always need a full stop to end the program. So after such legendary speakers, I will take it as a privilege to be the full stop to this wonderful session. So I'm sharing my screen. Actually, this is a Punarukti Dosh Yukta presentation with Sanjeev Rastogi and Asmita Veleji and Supriyaji, almost speaking everything what I had in my mind. So I will quickly take you through the presentations of Sanjeev sir, Rastogi ji and Asmita ji, what I claim it to be my presentation. Okay, so reports, scopes and limitations. So this is the very petrifying picture of phocomelia, thalidomide, this, and thereafter the impact, the scope of what has been done. In 1961, there was just a small 3 paragraphs of a letter. It is just a observational report. See the scope and what it has led to. In 1961, McBride WG presented this observational letter to Lancet. So what I quickly want to tell, just for the young students who want to write those papers, that there can be 4 dimensions of case report. Easy to remember: CASE, C for core principles of Ayurveda, A, Ayurvedic parameters. I am not going to the statistical definition of parameters right now, and modalities. Then some stories and statistics as S, and the ever-present evidence pyramid. So very quickly, I will take you through this. Core principles. This is the wonderful platform which standard straight-jacketed protocols don't offer us for Ayurvedic, what you call testing the hypothesis. So core principle like Purusham, Vikshaya, Geyo, Vishaguttama, all the P4, predictive, preventive, personalized, and participatory medicine can be tested in this particular, you can say, format. And therefore, this is much more important from Ayurvedic perspective. These are the Ayurvedic parameters which Asmita Veleji took you through great details. So it provides detailed, rich qualitative information, provides insight for further research, very important, permitting investigation of otherwise impractical, or if I may say so, some unethical situations also. This we can term as a black box design, where we can very confidently include Dushyam, Desham, Balam, Kalam, Analam, Prakritim, Vaya, Sattvam, Sattvam, and everything what we could, what we generally tend to escape behind the protocol rigidities. Here we can use whatever form of chikitsa we want to do with all the justifications, as Supriya ji has told us, what format we should use, what timelines we should use. We can just fill that format and templates, and we can use the Purusham Viksha Chikitsa Paddhati of actual Ayurveda. These are some of the scopes. Case studies or case reports allow researchers to investigate a topic in far more detail. That might be possible if they were trying to deal with a large number of research participants. Okay, with the aim of averaging. We do not want to average. So we can go into the greater details. Because of their in-depth, multi-sided approach, case studies often shed light on human thinking and behavior that would be unethical or impractical. Research which only looks into the measurable aspects of human behavior is not likely to give us insights into the subjective dimension, which is very important from the Ayurvedic point of view. And case studies or reports are often used in exploratory research, which can definitely help us generate new ideas. Very important as a pilot study sort of thing. The method is therefore important for researchers who adopt a holistic point of view. And as soon as you say holistic, the whole field of Ayurveda opens before us. Limitations: lacking scientific rigor and providing little basis for generalization. Okay, this is one of the most important limitation. Researchers' own subjective feeling may influence the case study, which we call researcher bias. This is the case studies or case reports are generally difficult to replicate. They are time consuming, and because they are only for one, they will be very, very expensive. What Asmita Veleji said of diagnostic outcomes, just think of it as the whole kit for just one person will be astronomical. The volume of data together with time restrictions in place, the depth of analysis that's possible within the available resources is also a very, very big limitation. There, I'm coming to the scope, very important scope of this unique kind of research presentation of case study or case reporting is the human value of the patient as opposed to a mere statistic. Very, very important consideration. So as this very famous book by Lisa Sanders tells us, every patient tells a story. So we can very well differentiate between the story and the statistic. And I'm not reducing the importance of statistic, but as a statistic, the patient story definitely gets the precedence. And when we are writing that case story as a report, we definitely have that human value at our side. And very, very importantly, the final word in this is the evidence pyramid. What I would like to point out here is like a cell is of human body. The case report is the building block of the body of evidence. No matter how we reduce it in its value, that it is after all at the base of the pyramid, but we should remember that it is the most important things which are at the base, the neev ki patthar. And on only those case reports do the evidence and the body of evidence keeps on building up in all kinds of higher level of hierarchies of meta-analysis and the systems and the summaries, everything. But it all starts with case reports. So remember that your case report, one case report becomes two, and then exponentially it may grow into a very beautifully constructed study. So I will not take too much time. We have been here since last 2 hours listening to the very big workers in this research field. So I would just end with the words of a very famous Hindi poet who gives this. This is the reference for the work I have cited. छोटी छोटी जल की बूंदें सागर को भर देती है, बालू की रज नन्ही नन्ही सुकर भूमि रज देती है, क्षण क्षण काल इकट्ठा होकर लंबा युग बन जाता है, क्षण को शूद्र न समझो भाई, यह जग का निर्माता है. Similarly, the smallest of case reports can lead to a very big body of evidence. Just keep on working, but most important is keep on publishing. Thank you very much, Girish ji, for giving me this opportunity to be a full stop. Thanks a lot.
Thank you, Pawanji. This is not just a full stop, but a very some small things ahead. I just wish to convey a message from Vaidya sir, although he talked here. The message is we should retain integrative approach and building bridges in practice and research. Case reports can be more than therapeutic outcomes. Case report is not just this is treatment and this is effect. No, case report can understand samprapti, case report can understand disease variation, disease subset. Case report can also interpret the disease in terms of Ayurvedic thinking. Case reports can provide several type of information, and hence it is not, sometimes it may not be say converted into templates. So there is also limitation of templates or checklists sometimes if we wish to share something else. It has a broad canvas of Ayurvedic fundamentals. It need to report Roga Pariksha, Rogi Pariksha, Ayurvedic variables for understanding disease and patient, and modern investigation to diagnose disease and assess treatment outcomes, and hence objective markers and patient-specific variables. Many times patient-reported outcomes, how do patients feel? Patient's perception is also very, very important, and hence case report is, as Pavanji really said, it is just a small thing, but it is not that small thing. There are many approaches and many dimensions they can be say covered into case report. With this, I will stop here, and I request now Professor Gerard Borekarji to say a few words, and then Dr. Galib will let us know what are our further program, and hence over to you, Professor Borekarji. I think Professor Bodekar doesn't need any introduction. A PhD from Harvard. He worked in University of Oxford for many years, worked with WHO for creating a world map of traditional medicine. He has been a connection between all various AYUSH systems, and he's now editorial advisor of Journal of Ayurveda and Integrative Medicine. Welcome, sir. We are very much happy with your presence. Over to you, sir, for concluding remarks.
Thank you very much, Girishji. Well, I did hear Dr. Goratwara say that he was the full stop. I think I'm the afterthought in that case. I hadn't expected to be saying anything, but you kindly invited me, Girishji. I just want to compliment the organizers, congratulate you, and to really say how delighted I've been listening to this whole program, to hear the level of exchange, the depth, the Ayurvedic perspectives, the methodological perspectives. And I think this sort of coming together that's been organized, this kind of methodological kumbh, is extremely necessary. And I think what we need to follow on from it is some coordinated system where people can register, like a clinical trial register, a case report register. People can register what they're doing, follow the specific methodology that's provided. And this is the beginning, really, of big data in Ayurveda. And big data allows for picking up small effects through studying large populations. And I think there's huge potential in this. And I'd encourage you all to work with IT companies and specialists towards that aim, because it puts Ayurveda really in its own term, on its own terms, in the front line of data analysis and mining. I also was wanting to mention, and I put a chat note to the panelists, that there is research coming out now showing that COVID is a vascular disease. We might think of it as something that's primarily pulmonary or immunological, but it turns out that fundamentally it's a vascular disease that attacks the endothelium that lines the blood vessels. And the endothelium, as you'll all know, is the vehicle for bringing nutrients into the body, so many other things. And when the endothelium is damaged, which studies are showing it is, by COVID, that helps us understand long COVID. Dr. Bailey mentioned that in her presentation, others have. And I think that this is something that Ayurvedic clinicians and researchers can think about. I mentioned it to one Ayurvedic colleague who said, oh, well, then if that's the case, we should use Google. I'm not the one to decide on that or comment or validate that, but something you all can look into. And I think considering COVID as a vascular disease could be a productive way to drill in for the future. In terms of therapies, I was very interested to hear esteemed Dr. Ashok Vaidya mention Andrographis paniculata, Tinospora cordifolia, and Sanjeevani as three important herbs in managing COVID. And I think that certainly Andrographis and Tinospora are very widely available, and they can be part of a home garden on a balcony of a flat. And I think that these are sort of things that, as a public health measure, an Ayurvedic public health measure, should be encouraged. Home protection against COVID, or early management of mild to moderate COVID. Grow your own andrographis. It's no harder than growing tulsi. And guduchi is a vine, of course. It can grow on a balcony railing. Have to watch it, it'll take over, but it's easy to grow. So I think the public health response is important as well, and messaging that. These are very important insights from Dr. Vaidya. And I think that's really all I want to say. I think this has been such a panel of diverse and high quality expertise. And it's got wings, it's got momentum, it should go forward. And I think this spirit of broad-based collaboration is timely, and it's necessary, and it is the way to move forward in establishing an a broad-based, evidence-based Ayurveda and hypothesis generation, which is the unsung value of case studies. So with that, I would thank the organizers, compliment all the panelists, and share with my fellow 500 audience members great appreciation for all of your efforts. Thank you, and namaskaram.
Thank you, sir. Thank you for your concluding remarks and guidance. I now request Dr. Galibji to announce what are the further developments we are plans in this direction. Over to you, Galibji.
Thank you so much, sir, Girishji. A warm good evening and namaskar to the galaxy of experts. So starting from Kotechaji to Geetaji and directors of all 3 national institutes. And yeah, all the panelists, starting from Rastogiji to just now we heard Bodekarji, Vaidyaji, and all physicians, teachers, scholars, and other stakeholders who are taking part of this event. You heard that, I mean, it is well known that, okay, so COVID-19, it has, it became I mean, it's a highly contagious and potentially a fatal manifestation, so that became a global health concern. And of course, everyone knows that it was declared as a global pandemic, and scientists all over the world, okay, so they are attempting to develop effective management strategies to address such kind of situation, and collecting data and comparing the outcomes. So it is being recommended globally. So this is well known, and attempts are also being made to integrate traditional interventions along with standard treatment protocols for COVID-19. So Ministry of AYUSH has also released a series of advisories to improve individuals' immunity to, I mean, in addition to the general advisories, so that can be useful in restoration of health, and also as an add-on supportive management of COVID infection. Of course, I'm sure that, okay, so there are huge numbers of so AYUSH physicians from different corners of the country have their own ideas and their own thoughts, and so they are, I'm sure they are involved in addressing this pandemic situation of various levels of, let it be prevention to management to, okay, so post-COVID complications, etc. But at times, okay, so what was mentioned in the opening remarks by Ramji, so he partly mentioned that, okay, so it has been noticed that, okay, so many of such kind of effectiveness of the treatment strategies, okay, so they are being shared on social medias. I mean, using various e-platforms, okay, so that may not be that may not serve the purpose of science. And such effectiveness, okay, so it may many attempts it may remain anecdotal. So such experiences, okay, so need to be effectively and systematically communicated to the scientific community, following the applicable guidelines. So scientific communication, so is essential. So I mean, particularly in this pandemic, I mean to say that effective practices, okay, so need to reach all stakeholders in a proper time so that suitable action may be taken in the benefit of global healthcare system. So undoubtedly, so these case reports, they serve as the first line of generating evidences, and they definitely make a meaningful contribution to the systems, medical systems, and put forward unique treatment modalities. So physicians and scholars of various institutes and other professionals, so who have good content, who have credible clinical information, so they can submit the the experiences, so in a specified format, as Kishore Patwardhanji was mentioning, so that AYU case archives. So so this credible clinical information, so that content, okay, so in a specified format, so that can be submitted to AYU case archives. So which is one encouraging, I can say it's an intermediary platform. So this platform will handhold and support, okay, so these communications, to be refined so that the same can be published in some good journals. So this is one activity of okay, so that archives. But at the same time, considering the importance of this scientific communications, the current webinar, it was planned. So which is just like a curtain riser. So this is not end. Okay, so as Pawanji was mentioned, so this is not end. So this is just like a curtain riser. So this will further be followed by a series of workshops. Of course, the exact schedules of the proposed workshops, so they will be communicated so well to all the interested in advance. So we prepared a Google form for this, and the link was so just shared by Girish ji, okay, so in the chat box. And so this form it is very simple with very basic information, so related to the experiences on COVID management, like, okay, so whether you have treated COVID-19 patients or not, or do you have some data on okay, so publishing at least one COVID case report. So where Ayurveda modalities, Ayurveda treatment strategies have been used, whether you published, okay, whether you have any published case reports and COVID related case reports in your credit or not, such kind of very basic information. So we asked. So the workshops are being organized to encourage and help AYUSH clinicians to prepare case reports that meet the care guidelines for publication in peer-reviewed and indexed research journals. So there's all healthcare professionals with some basic data on COVID management are invited to fill the simple Google form and submit it, so that okay, so in future workshops, okay, so we can communicate you well in advance, and we can involve you. So this is in brief about okay, so what we are planning to come up. So thank you so much for your time and patient presence, and your involvement, and your case reports are highly essential, so that will contribute as building blocks in healthcare system. So thank you so much for your patient listening. So thank you, sir.
Thank you very much, all the participants, for your active participation that made this workshop successful. We have to go a long way. We will end with this prayer. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani paschantu, ma kaschid dukkha bhag bhavet. I thank all the audience, all the speakers, Vaidya Kotecha ji, all the heads of national institutions, and the support from Savitribai Phule Pune University's Center for Innovation and Linkages, Dr. Apurva Palkar ma'am, Satvashil Jagdale, Rasika Chinskar, and Mr. Akshay Datar, and the team from AYUSH Center of Excellence. Thank you very much, my friends. I hope we will work together, and we will be happy to work with you, and the experts and the resource persons. They will be very happy to work with you. This was possible because of a very good support and guidance from all the directors of institutions. So I'm thankful on behalf of organizers, and on behalf of Ram Manohar ji, who worked hard despite of his illness, but he has recovered. That is the good news. So thank you very much. Let us work together. Thank you.